Mr. President, I rise today to discuss the health care bill that the Senate will begin voting on tomorrow evening. Let me begin by making clear that I believe our healthcare system needs fundamental reform. One of my top priorities as a senator has been to work to expand access to affordable health care. The fact is, however, Mr. President, that the greatest barrier to health care coverage today is the exploding cost. Monthly health insurance premiums in Maine have risen at an alarming rate. They now often exceed a family's mortgage payment. And whether I'm talking to a self-employed fisherman, a displaced mill worker, the owner of a struggling small business, or the human resource manager of a large company, the soaring cost of health insurance is a vital concern. Mr. President, much of the health care reform debate so far in this Congress has centered around the need to expand coverage to the uninsured, a goal that I embrace. The fact is, however, that it will be difficult to achieve our goal of universal coverage until we find a way to control health care costs that have driven up the cost of insurance coverage for families, employers, and governments alike. While I agree that our healthcare system is broken and in need of major reform, the bill that we are about to consider falls far short when it comes to reining in healthcare costs. This is a critical issue. It is the critical issue because the high cost is the biggest barrier for those who lack insurance. The high cost of health care is what is driving up the cost of insurance premiums, causing many middle-income families and small businesses to struggle to meet these needs. I'm concerned that this bill takes us in the wrong direction and that it will actually increase the cost and reduce choices for many middle-income Americans and small businesses. In my home state of Maine, 87.5% of those purchasing coverage in the individual market today have policies with an actuarial value of less than 60%. In other words, they have policies that do not qualify under the standards that would be established in this bill. The most popular individual market policy sold in Maine costs a 40-year-old about $185 a month. Under Senator Reid's bill, that 40-year-old would have to pay at least $420 a month, more than twice as much for a policy that would meet the new minimum standard or pay the $750 penalty. Mr. President, I believe that Americans should have the choice to purchase more affordable coverage, if that is what works best for them. Healthcare reform should be about expanding affordable choices, not constricting them. It should not be about forcing millions of Americans to buy coverage that is richer than they want, need, or can afford. Mr. President, how does this bill help small business? On balance, it doesn't. And that, again, is not just my opinion. That's the opinion of our nation's largest small business group, the NFIB. In a statement of the bill released yesterday, the NFIB said, "This kind of reform is not what we need. new taxes, new mandates, new entitlement programs paid for on the backs of small business. In fact, NFIB described the bill as a disaster. And Mr. President, I would ask unanimous consent that a copy of the NFIB statement be entered into the record at this point.
Will be done.
Now, Mr. President, there are some provisions in the bill that are intended to try to help small business, but again, they miss the mark. I support and have long proposed the idea of tax credits for small businesses to help them afford to provide health insurance for their employees. But the credits for small businesses in this bill are poorly structured. Only businesses with no more than 10 workers paid an average of $20,000 can get the full tax credit. So if a small business hires additional employees or pays more, its credit begins to decline and is eventually phased out. Businesses with more than 25 workers or paying average wages of above $40,000 get no tax credit whatsoever. So just take a look at this. I realize this chart's a bit busy, but stay with me. Under the Finance Committee bill, if you have 10 employees and you pay them on average $20,000, you get a 50% tax credit applied to the cost of the insurance. But then what happens is if you give them a raise, the tax credit begins to decline. So if you have 10 employees, but if you pay them $25,000 on average, you only get a tax credit of 38%. Let's say you're trying to improve their quality of living. They've done a great job for you. So you give all your employees a raise, bringing the average wage to $30,000. Now you're only going to get half as much of the tax credit as when you paid them $20,000. If you pay them $40,000 on average, zero. You lose the tax credit altogether. Mr. President, what we have here is a tax credit that is structured in such a way that it discourages small businesses from adding employees and paying them better. That doesn't make any sense at all. That makes no sense at all. Mr. President, this legislation would have enormous consequences for our economy and for our society. There are several provisions in this bill that I support and that I believe have broad bipartisan support. It is so disappointing that that isn't our focus. Then we could add provisions, come up with the best ideas on both sides of the aisle. We have to remember that this bill would affect every single American, every small, large employer, every healthcare provider. It affects 17% of our economy. There are many reforms, such as allowing small businesses to pool together to have better bargaining clout, that have strong bipartisan support that could have been the basis for further debate and amendments. So it disappoints me greatly that we are about to proceed to a divisive partisan bill. I continue to believe that the American people would be better served by a bipartisan bill that brings together the best ideas on both sides of the aisle. And I pledge to continue to work with members on both sides of the aisle to develop alternatives that will bring about true health care reform. Thank you, Mr. President.